Well, I think there are several reasons. First of all, if you look at the individual trials that make up the guidelines, there are times when the guideline is really a consensus of opinion. And there may be situations in which that opinion doesn't apply. I think that for instance, among patients that are very poor, in whom medications are very expensive or unattainable, then I think it's very hard to follow the guidelines. I think you have to take a much more conservative approach among those patients because they're not going to be able to follow up. Sometimes the physicians are ignorant of the guidelines. Sometimes it makes, sometimes they're driven to avoid the guidelines or give care that's not guideline based because of economic pressure. I think you can take the guidelines and look at them and sort of form your own opinion. They're written loosely at times, and they can generate. You can use them to generate a reason for doing more procedures. But for the most part, the guidelines are written very conservatively, and if you follow the guidelines, then I think you're giving your patients care that the evidence will support.
Can the American College of Cardiologists place stricter guidelines to use more objective assessments?
I think the American College of Cardiology is doing that. I think there's much more emphasis on delivering not only guideline-based care, but appropriate care. And there's more information available to physicians to help them sort out those areas where the guidelines are gray. I think there's a strong effort within the American College to get on top of this issue and try to do the things that will help patients live longer and do better. And so I think that this is underway. If you look at the publications that come out from the American College and other entities, more and more of it is aimed at helping us find those patients from among this huge group, right? Coronary artery disease is very, very, very common. So among this huge group of patients that either have silent coronary disease or symptomatic coronary disease or are very, very sick from coronary disease, who gets benefit from a more aggressive approach? I think that evidence is accumulating, and the college is doing a pretty good job of getting it out to us. You just have to be aware and adherent to what you're taught.